This is Brent of the Brookbush Institute, and in this video we're going to go over manipulations or high velocity thrust techniques. I assume that if you're watching this video, you're watching it for educational purposes and that you are a licensed professional with high velocity thrust or manipulation techniques in your scope of practice. If you're not sure, check with your state board. Most physical therapists, chiropractors, and osteopaths, you're in the clear. I believe that ATCs, you can't do manipulations in the United States, although other countries. Again, check your scope. Of course, massage therapists and personal trainers, these are generally not within your scope. Of course, you could continue to watch these videos just for educational purposes, learn a little anatomy, learn a little biomechanics. If you're going to do these techniques, please make sure that you have a good rationale for putting your hands on a patient. This should be based on assessment, and if you're going to assess, I'm hoping that you'll assess, use these interventions, and reassess to ensure that you're getting the result that you're looking for and have good reason to continue using this technique. In this video, we're going to do a cuboid manipulation. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Remember, if I'm doing manipulations, I'm using more than passive accessory motion and more than just subjective complaints. We want to make sure that we have some sort of movement or postural exam, like the overhead squat assessment, to see what compensation pattern we're actually trying to correct. And I like to use continuous interval measures to track progress. That's something we can measure objectively. In this case, I'd probably use the navicular drop test with like a ruler so I can see how many centimeters of height we have between that navicular tubercle and the floor. Now, the last thing I'm going to go to is, of course, my passive accessory motion exams to indicate whether this particular joint is stiff, and it's actually several joints here. We are manipulating the cuboid bone, but we have to keep in mind that the cuboid has joints with the calcaneus, the lateral cuneiform, and the navicular a little bit. And what we're trying to do is see if it'll tilt this way on kind of the combination of those three joints. Now, the first thing we have to do is be able to palpate the cuboid, which is not terribly hard. If you guys just kind of think about the fact that the cuboid is on the lateral side of the foot, and essentially on the lateral side of the foot you can palpate the calcaneus, the fifth metatarsal, or the cuboid. Now, what I'll usually do just kind of instinctively is I'll start grabbing at the side of the foot until I feel something that feels kind of like wedge shaped, right? Like right here it feels a little wedge shaped, but it's not the round, long bone of the fifth metatarsal. All right, so I got this wedge shaped bone and it'll actually wiggle for me. Right? So this will wiggle. This is definitely skin, there's no bone here. This is a bone that'll wiggle. And then this one you can kind of feel as like you can feel the whole lever move. All right, so now that you have the cuboid, really kind of take a second to palpate around. You'll notice it's a pretty sizable bone. It feels like almost half the width of the foot, right? So it takes, not this way, right? It's only about maybe on Yvette's little foot here, maybe 1.5 inches long, but it's almost as wide as like half the foot there. All right, so I'll feel around there. You kind of feel like you get this feeling like it has like a little curvature to it, so like it's shaped a little like if I turned my hand this way, right? So I can kind of put my thumb in this little divot in the cuboid, or at least it feels that way. All right, so now what I want to check is this when I do my passive accessory motion. Of course, I can just kind of wiggle back and forth, dorsal to plantar. But what I think you guys are going to find is that's not what gets stuck. What gets stuck is the ability to move this way, almost like a rotation. And I guess we could call that external rotation of the cuboid bone, but it's probably more like inversion, eversion of the cuboid bone. And I think you'll get this sense that the medial edge doesn't want to move the same way. So the outside edge will wiggle on you a little bit, and then you get to the medial edge and you're like, that does feel a little stuck. So now how do we manipulate this joint? So keep in mind, manipulations are always about setup first. Just because we know where this bone is, we don't just want to go snap. It's not going to work. Remember, we're trying to get range of motion back, so we want to lock out all the range of motion she has in a particular direction and then push past the resistance barrier. And the way that looks with this particular joint is I'm going to put the cuboid right here in my hand on the outside, I actually like to use my thumb on the inside, right? So I'm just like this, and I'll show you guys this closer in the close-up recap. And what I'm gonna try to do is twist the cuboid this way. But before I do that, I gotta lock the cuboid out. So I'm gonna take all of the inversion that I have up, right? I'm gonna take her all the way as far into inversion as I possibly can. I'm gonna plantar flex the foot as well. Not plantar flex the ankle, plantar flex here, her metatarsals, her transverse tarsal joint. I wanna take up all the slack in the top of her foot. So I get here, and then what you wanna do is not this, right? Which is instinctively, like plantar to dorsal, you'd be like, yeah, that's the manip, right? But with this particular manipulation, there's so much leg involved that if I did this, like you can see, it just got knee extension. That's not what I was trying to do. I want to get more inversion at the cuboid. So I'm going to take up all the slack in the foot here, and then this is cool. All you really need to do is just go like that. It's a whip. I don't know if you guys heard that. That was actually a pretty loud cavitation for the cuboid. Usually this is one of those ones that you'll feel the cavitation and you won't hear it. But I just took up all the slack and then I just kind of like whipped her foot. All right, whap. So again, guys, find the cuboid, wrap the outside of the cuboid on this part of your hand, right? So this is going to help us turn into inversion from the top side. This side, you're going to press the medial portion of the bone down this way. I've even seen some people with really great technique here use their pisiform hamate like this. My problem is my hands are kind of stupidly big and I can't get that part of my hand into that part of this little foot. Right? I just happen to be a lot bigger than a vet. For some of you guys with like less difference between the size of your patient and yourself, that might work out better, and then you can get to the end range here and that would look a little bit more like a PA. You do a whip, but it would be more like a PA you do on the spine. So that might be more comfortable for some of you. But again, you're gonna outside, wraps up the outside of the cuboid. Here, I'm gonna end up using my thumb on the medial portion, plantar flex all the way, not the ankle necessarily, the foot, invert as far as you can, right? Again, forefoot, not necessarily the ankle, get all the way to end range where you feel that lock position and play with it if you have to for a second. Like really feel like you have the cuboid to a point that it doesn't want to move anymore. And then once you're there, just give it a little whip. All right, guys, stay tuned for the close-up recap. All right, for a close-up recap, you guys can see here, like if you grab here, you got the calcaneus, then you got some skin, and then right as I get down to about here, like I feel bone again. This is her fifth metatarsal. This is her cuboid. So I'm gonna put my thumb on the medial aspect of her cuboid. Then I'm going to take this part of my hand, put it on the outside of her cuboid, and my goal here is to push this way with this finger and then pull up this way with my hand so that I'm tilting the cuboid this way. All right, so we get all set up, and then I mentioned before, remember we want inversion and plantar flexion of the foot, and you guys can see the difference between inversion and plantar flexion of the ankle, right? Where you get all this calcaneal motion as opposed to inversion and plantar flexion of the foot, where you guys can see the calcaneus stays basically in place. All right, so once I get her all locked up, I can pull all the way down into end range. And then of course this time, the manip, guys, is not just like a thrust PA. We're just gonna give the foot a little whip, and that's it. That was the entire manipulation. So take your time getting set up, get your hand over the cuboid, get your thumb, or you guys can use pisiform hamate in here if you got smaller hands, or at least hands that are smaller compared to the person's foot. You're gonna plantar flex and invert the forefoot as far as you possibly can, and then just a little whip. And of course, you guys could use something like the navicular drop test to go ahead and measure pre-test, post-test. A couple of points to recap. Knowing your anatomy and knowing your biomechanics will certainly help you choose the right technique for the right patient. If you're unsure whether manipulations are appropriate due to their higher intensity, it's okay to do mobilizations. Most research points to manipulations being slightly more effective, but mobilizations being very effective. And of course, we have those videos for you if you want to start with those less intense techniques. Make sure that if you are doing any technique that is based on assessment, and of course that you're reassessing, ensuring that the technique is effective for the patient that you're working on. And when it comes to all manual techniques, guys, manipulations, maybe more than any other, look for opportunities to get live education. Although I know videos are convenient and I'm happy to have these up for you guys to watch, it would be so much more helpful to use those videos as a recap of one-on-one attention with somebody who's experienced with manipulation techniques. At the very least, grab a colleague, grab a friend, and start practicing these before you bring them into clinic and start using them on patients and clients. I hope you enjoyed this video. If you have any questions, please leave them in the comments box below.